Chapter 4, Communicating with Children and Families. The component of effective communication should basically be a review for you. You learned about effective communication and foundations and just carried over to this course. Touch can be very comforting to many and shows a way of caring. Everyone does not like touch and can make them feel uncomfortable, so always ask before touching. Also, be sure to take cultural aspects into consideration. Not all cultures view touch as appropriate or caring. Physical proximity and environment can be very important, especially for the pediatric population. Having a pediatric room incorporate a child theme can help them feel at ease and help them with the stress they may be experiencing. Keeping things at a child's eye level can help as well. Being sure to have areas of privacy when you are doing assessments or asking questions is crucial as well. Use active listening skills to help with communication. Don't just ask a question to ask. Be prepared to listen and respond. Visual communication and body language can go hand in hand. Thinking about how you are dressed to a child can make a difference. They may have a fear of anyone who wears a white jacket. They may think men with a bushy beard can be scary. Be aware of your surroundings and things you carry into the room as well. Getting at eye level with a child is helpful. They won't feel like you are towering over them. Table 4.1 lists open versus closed body postures. Timing is very important in our pediatric population. You need to build a rapport with that child. Do not go right into that room and perform your assessment without talking to the child first. They need to know that they can trust you. We'll talk about ways to build rapport and trust coming up. Family-centered communication is a big part of providing family-centered care. The first thing you have to do is build a rapport not only with the child, but everyone involved in the child's care. This involves finding out who that person is and how they are involved in the child's care. When you enter the room, you need to introduce yourself to each person. Do not just address the child or the parent. Include all members. Be non-judgmental and include them in your plan of care. Asking how the parents or caregivers are doing. Do they need anything? Be available to them and make them feel like they can come to you with their concerns or questions they may have. We need to empower the family to be involved in the patient's care. We can do this by involving them in the education process. Allow them to voice their concerns or questions. Provide positive feedback to help them know they are doing a good job. Be sure to find out the best way they learn so you can provide the education in that format. You will learn that growth and development is a big part of our pediatric portion of this class. Growth and development outlines the milestones children should be reaching by certain ages. It's important that we are aware of these milestones so when we assess, we are aware of any deficits. Later in the semester, we will go over growth and development, but this week we're talking about it compared to the relationship to communication approaches. You cannot communicate with a 2-year-old the same way you would communicate with a 16-year-old. This helps outline what is appropriate for each age. Table 4.3 outlines these, and I will discuss just a few from each age group. Infants, the main way they communicate is through crying or babbling. We need to use calm, soft voices and be responsive to their crying. Talk to the infant as you are doing your assessment or procedure. You must allow the older infant to get used to you or they will be afraid and not cooperate. Toddlers has an increase in verbalization. No tends to be their favorite word, so you must be careful on asking yes or no questions. Learn what words they use. Use picture books as age appropriate. Preparation for something you are going to do should be immediately before you do it. For example, do not tell them you'll be back in 5 minutes to give them a shot. Tell them just before you do it. Preschoolers have a growing vocabulary. You want to give them choices, but once again, be careful on the choices you are giving them. Do not ask them if they want to take their medicine. They could tell you no. Ask them if they want their medicine in a cup or in a syringe. You're giving a choice, but either option is fine. Use picture books and play for demonstration. Preparation should occur right before the event. School age has a good handle on vocab and can understand more concepts. Use picture books, diagrams, videos to explain. Establish limits and set consequences. Introduce preparatory materials 1 to 5 days in advance. Adolescents, they're able to verbalize and comprehend most adult concepts. Use collaboration approach and support their independence. Introduce preparatory material up to a week in advance. Respect their privacy. This includes not asking certain questions in front of the parents. There can be some obstacles when communication with children, and this includes children with special needs. We need to find alternate ways to ensure effective communication. The first thing is always to assess their self-help skills. A few examples of ways to communicate with a child who is visually impaired include orienting them to their surroundings. This can include walking them around the room and telling them where certain items are located, keep a clear path for safety, and keeping things in the place you told them they were located can help. Encourage parent or other caregivers to stay with the child. Identify yourself every time you enter the room. For the hearing impaired child, identify how the family communicates with the child and try to utilize the same resources. Developing a communication board can be helpful. Gentle touch the child before speaking. Face the child when speaking. Do not shout or exaggerate your words, and watch for your nonverbals. For the child who speaks another language, obtain an interpreter to assist.